Hello everyone, my name is Steve Lawson.
And my name is Anja Fofana.
And we're from GE Healthcare's global MRI business. Welcome to another episode of Behind the Console, where we show you and demonstrate to you the latest innovations in MR technology.
Today we want to talk about the next software release, MR30 for SIGNA, and we want to show you an example how that advanced your abdominal imaging. So in abdominal imaging, you usually use to scan a lot of 3D sequences, and we want to show you with the MR30 release, where AIR Recon DL is applicable for 3D sequences, how you can use that in advantages to shorten maybe breath hold scan times, or maybe go really high in resolution. And we did already like a scan here on our volunteer in the bay on our SIGNA Hero scanner. We used the anterior array, the AIR coil with 30 elements on top of him, and we used our wireless gating to gate these sequences, and we want to check out the image quality with you guys.
So we're here at the MR scanner, so let's take a look at some of these abdominal images that Anja scanned earlier. So let's start with the T2 weighted scan. So this image here on the left, this is a coronal single shot T2. This is a 50 centimeter field of view. So the AIR anterior array has extended coverage, which is great for scanning abdominal and pelvis imaging. So maybe you've got an oncology patient, or maybe you're just not certain as to where the anatomy is that you want to scan. This coil gives you that flexibility to be able to scan this way. Also, on top of that, we were able to use arc factors of 4 to be able to reduce the scan time, get sharper images because these are single shots, so the higher accelerations do help that way. Another scan that was done here is this axial T2 snapshot. Now this is a free breathing T2 weighted single shot fast spin echo. So it acquires multiple slices for every respiration. It's going to be dependent on the patient's respiration to be able to do that. So if the patient's breathing slower, you'll actually get more snapshots in that respiration cycle. So it can really accelerate these types of scans. So this is a T2 weighted scan, minute 14, patients breathing comfortably. So really great image quality. And the slice thickness, I want to point that out too. So we're doing 4 millimeter slices. Usually T2 weighted scans, most customers have probably done 6, 7, 8 millimeters. Those don't really match up to the dynamic T1 weighted scans that customers are doing. So it's kind of nice now that we're able to get those thinner slices for our T2 weighted scans.
Yeah. And now we want to show like the 3D sequences we improved with AIR Recon DL. So we scanned our lava sequence, which we use for dynamic scans. And we want to show you like really in the 2 different ways we can see the advantage of AIR Recon DL. Here it's applied to get really fast scan times, right? We shrink down the scan time to 8 seconds. We still have like 4 millimeter slice coverage here in that slice. We cover the entire liver. So really, really nice that you can have now short breath hold scans and our 3D sequences. And then the other way we think customers are going to use AIR Recon DL is to really enhance the resolution. So here we are looking at the same field of view, but we have the in-plane resolution of 1.5 millimeter isotropic. So now we can easily reformat in any other orientation without repeating the scan. So really, really nice that we have the advantage here with AIR Recon DL to acquire now an isotropic volume for our dynamic scans. And then on top of that, we can apply AIR Recon DL to other 3D sequences. Here we want to show you that we applied it to our IFA sequence, which is our non-contrast angiography for the kidneys. So no contrast media needed. It's a free breathing acquisition here as well, applied with AIR Recon DL. So if your patient has contraindication for contrast media, it's always in your back pocket now to have that also with AIR Recon DL. And then I want to show you another scan, 3D scan, which we use for our MRCP. So that also is now reducing the scan time or enhancing the in-plane resolution here, all free breathing scans too. So really easy on your patient to get acquired.
So as you can tell, there's a lot of really great enhancements in MR30 for SIGNA. We were really thinking that our customers are going to really take advantage of a lot of these great features. So we just wanted to share that with you today. Thanks so much to watching this episode of Behind the Console.
Thank you. Bye-bye.
Thank you.